that start from 30000 to 32888. So this is a code ranges for respiratory system. Please take a note. 30000 already. Oh, so guys, for the entire surgery, basic key. Take a note. For the entire, for entire surgery section.
Ma'am, your voice is breaking.
Others? Okay. What about others? Am I audible now? Am I audible?
Audible, ma'am.
In this section, we have to follow 3 basic key terms. 3 basic key terms. Okay. Guys, everybody receive the link in our app, am I right? Sorry, in our WhatsApp group. I already shared the link on 3 p.m. In all of that batch, I already shared the link at morning also. Morning 7:45, I shared the link, but some of the students not get the link till now. I don't know why. Yeah, I already shared. Site, procedure and approach. Anatomical side, procedure and approach. These are the basic 3 key terms for the entire surgery sections. Not only for this respiratory. So for the entire surgery section, we have to just check that anatomical side, procedure and approach. Anatomical side, where, what, how. Where, what, how. Okay, in which anatomical site, what type of procedures has been done by using of approach. Approach is nothing but open surgery that indicate the technique of that surgery. Approach is nothing but technique of surgery. Open procedure, percutaneous, laparoscopy, like that. So these are the approach. So here in this 30000, the anatomical site is nasal, procedure is drainage. Drain the abscess or hematoma from anatomical site through internal approach. Internal approach means surgeon make a cut on the inside of our nose. Okay, inside of our nose and drain the abscess or hematoma. That is internal. So same like that 30020 for what is the anatomical site? What is the anatomical site? Procedures are same. Drainage, but the anatomical site is different. For nasal means go for 30000. For nasal septum means go for 30020. So 30020 for nasal septum. If it is a rhinotomy means go for 30118, 30320. So this is a hint. Under the code description or sometimes in above the code description, they will indicate some instruction. So that will be our answer in our question, in our CPC exam. Okay, so you must give the priority to read that hint also. Here for nasal internal approach go for 30000. And under the code description they clearly mention for external approach means go for 1 series. This is a hint. You must read the hint also. Sometimes that will be answer. That's why you must give the priority to read the hint. So for external approach, go for 1 series. Internal approach means go for 3 series. Did you understand this line?
Yes, ma'am.
And now check that what is the procedure and what is the anatomical side.
Intranasal.
Biopsy is the procedure. Biopsy is the procedure. Nasal is the anatomical site. So under the heading of excision, incision, repair. So if the code description codes that are present under the heading of excision, incision, repair means that type of procedures are considered as open procedure. Take a note. Under the heading of incision, excision, repair. Under the heading of incision, excision, repair, that type of procedures are considered as open surgery. That type of procedures are considered as open surgery. So obviously, is this a open surgery or closed surgery?
Open surgery.
Open. Okay, then next, check that 30110. What is the procedure? What is the anatomical site?
Nasal is the anatomical site. Nasal is the anatomical. Simple.
Actually, nasal is the anatomical site. Excision of polyps is the procedure. Excision means removal. Excision means removal. Remove the polyps from nose. That is the meaning of that code description. If you are understanding the meaning of that code description means you can easily understand the code description, question also. If you are understanding the code description means you can easily understanding the question also. Okay, now the procedure is removal of polyps. Anatomical location is nasal. So in this nasal polyps removal, we have two classification, simple and extensive. For simple, if that procedure is completed by the physician in office setting, office means OP setting, office means outpatient setting. If that procedure is completed by the provider in office setting means that is simple. For hospital setting means should consider as extensive. For extensive means we should consider as extensive. Office setting means that is simple. For extensive, hospital setting. For bilateral means on the both side of nostril. If that procedure is performed on both the side of nostril, go for 50 modifier, bilateral. And check that 30110, what is the procedure? And what is the anatomical site?
Ma'am, for
7.
nasal, excision of intranasal, lesion, ma'am. Excision of lesion.
Lesion. So the above code for excision of polyps. Here, excision of lesion. Okay. Here, procedures are same. Anatomical site is also same. But what is the reason? Why here? What has been removed from that nose? So if surgeon remove polyps means go for 10 and 15. Suppose if surgeon remove lesion means go for 17. Excision or destruction, intranasal lesion means 30117. Now, here the procedure is also excision. Excision, that means removal of inferior turbinate. See that? This is a superior turbinate, middle turbinate and inferior turbinate. So removal of inferior turbinate, go for 30130. If it is a partial or complete, whatever it is, removal of inferior turbinate 30130. Here the hint is also present here. excision of superior or middle turbinate means go for the unlisted procedure code. Here they are clearly mentioned. This is a hint. We already discussed that you must give the importance for superior or middle turbinate means you must give the code for unlisted procedure code. How can we determine the code is unlisted means if that code is end with 99 or 999 means that is unlisted procedure code. If that code that end with 99 or 999 means that type of codes are unlisted procedure code. 1 minute. Body. For rhinotomy means go for 30320. Okay, for rhinotomy, go for 30320. So according to the procedure, we have to select the appropriate code here. Now, check that. What is the procedure? 30400. Rhinoplasty. Nose job. Rhinoplasty means nose job, correction of nose. In that rhinoplasty, we have two classification, primary and secondary. In that rhinoplasty, we have two classification, primary rhinoplasty and secondary rhinoplasty. Secondary means that is a follow-up. So in that primary rhinoplasty, if a physician just correct the tip of the nose, if a physician just correct the tip of the nose means go for 400. For complete external part means go for 410. So if surgeon just correct the tip of the nose, go for 400. Complete external part, okay, nostril, both the nostril also, that will 410. So including septal defect. Okay, if surgeon also correct, see that this is a deviated septum. After surgery, the septum has been corrected here. So for including septal defect, go for 420. Including septal defect, go for 420. So the above three code section for primary rhinoplasty, then the below code section for below three code section for secondary. Same like that. Suppose if a doctor just corrected tip, code 30. Intermediate revision means that means bony work with the osteotomy. Surgeon also make a cut on the bone of the nose also. So for intermediate revision, that means osteotomy is the key term. Okay, bony work with the osteotomy is the key term for 435. For major revision, that means nasal tip and osteotomy. That is the key term. Nasal tip and osteotomy, both. Nasal tip alone 430. Bony work alone 435. Both means go for 450. So these three code sections for secondary rhinoplasty.
Ma'am?
Yes?
Ma'am, osteotomy means correction of bone also.
Cut. Osteo means bone, otomy means cut. Surgeon make a cut on the bone to correct the nasal structure. Okay. Then 30460 for rhinoplasty, deformatory. This is a secondary surgery to cleft lip or cleft palate. Please mute yourself. So doctor first make a correction to correct the lip, cleft lip or cleft palate. After that, he complete the procedure to correct the nasal. Doctor first make a surgery. Doctor must make a surgery to correct cleft lip or cleft palate. Okay. After that, he perform the surgery to correct the nasal. So go for 460. stenosis. What is the meaning of stenosis?
Narrowing.
Narrow. So for vestibular stenosis, see that the image narrowing of vestibule. For vestibular stenosis, go for 30465. For vestibular stenosis, go for 30465. 1 minute. Here the line is hiding here. Both the side of nostril. Suppose if surgeon perform the procedure either right or left means should upon modifier 52 along with 30465. Should upon modifier 52 along with 30465. Did you understand?
Yes, ma'am.
Then septoplasty. Septoplasty means, see that this is a deviator septum. This is a deviator septum. This is our normal septum. Correction of septum, go for 520. Correction of septum, go for 520. For atresia, for corner atresia, intranasal. So, what is the meaning of atresia? Please take a note. Please take a note for atresia. Lack of normal opening. So, take the meaning of atresia. Atresia means lack of normal opening. So, here surgeon make a surgery to correct the problem of atresia through intranasal. In that intranasal 540 transpalatin, through palatin. So through palatin means 545. Here intranasal is the ketone for 540, transpalatin is the ketone for 545. Okay. So the procedure is repair of atresia. Atresia means lack of normal opening. Then synexia. Lysis means destruction, destroy. Destroy the lysis. So destroy the synexia. It's a blockage. So for destruction of blockage in intranasal 560. And fistula, repair. Here we are selecting the code. Here we are selecting the code based on the condition. So usually based on the condition only they are performing the procedure. Am I right? Based on the condition only they are performing the procedure. So for repair of fistula, fistula means abnormal opening. Take a meaning. So atresia means lack of normal opening. Fistula means abnormal opening. So for fistula, oromaxillary 580, oronasal 600. Location. Here the procedure is repair of fistula. Anatomical location is at the location of oromaxillary 580, oronasal 600. For dermatoplasty means go for 620. Dermatoplasty 620. So here the name of the procedure directly mentioned by the provider. Don't worry. Now in this, combine with the 31030 if androtomy is inclusive. That means repair of fistula procedures is combined with the 31030 means androtomy is inclusive. That is the meaning. Combine of 31030. Along with the repair of fistula means antrotomy is inclusive. Did you understand now? Did you understand?
Yes, ma'am. Yes, ma'am.
Then, what is the procedure? Take that.
Control nasal hemorrhage.
Control the nasal hemorrhage. So here epistaxis. Epistaxis. In epistaxis we have two classification, anterior and posterior. In epistaxis we have two classification, anterior and posterior. One minute. One minute, guys. Guys, please stay on the line. Anterior and posterior. See that the image. This is the anterior epistaxis. You can feel that means the bleeding will occur through the nostril. That is anterior. Posterior means you can feel the bleeding in your throat. Okay, you can feel the bleeding in your throat only. That is posterior epistaxis. So in that anterior epistaxis, we have two location, simple and complex. In epistaxis, we have two classification, simple and complex. So limited cautery or package is one. In that anterior epistaxis, it have two classification, simple and complex. If doctor use limited cautery or packaging means that is simple epistaxis. Simple. So extensive cautery or packaging is used means that is complex. Limited cautery or packaging is used means that is simple. Extensive cautery or packaging means that is complex. Then I give one more important key term for complex. Please take a note. Uncontrollable bleeding, unstoppable bleeding is also the key terms for complex epistaxis. Uncontrollable bleeding, non-stoppable bleeding is also the key terms for complex epistaxis. Then in 30905, posterior epistaxis. In that posterior epistaxis, we have two classification, initial and subsequent. Initial, patient suffer, that means doctor give the treatment for the patient at first time. That is, the patient suffered by the problem at the first time. Initial. Subsequent means for the recurrent condition, go for subsequent. 906. For recurrent condition, go for 906. So first you have to check whether the epistaxis is anterior or posterior. Then based on the classification, you have to select the appropriate code section here. Then 30915, ligation. Ligation means joining. Joining.
Okay, ma'am.
Okay, 1 minute. Model artery 915 for internal maxillary artery 920 for internal maxillary artery. So for external carotid artery, ligation of external carotid artery means go for 37600. 37600 for external carotid artery. So ligation means joining. 30930 fracture nasal inferior terminate. Fracture nasal inferior terminate. So that means doctor break the bone, break the nasal bone for therapeutic purpose. Doctors break the inferior terminate for therapeutic purpose. So that means for treatment basis. For treatment basis, he break the bone. Go for 30930. 30930 for nasal terminate, inferior terminate, therapeutic fracture. Now, here the procedure is lavage. Flushing or washing. Flushing or washing. Okay. So here lavage means
Ma'am, in previous, how to apply modifiers, ma'am, with those codes?
For what?
Right, ma'am. How to apply modifiers, ma'am?
For what? For bilateral procedure. So package is applied on both nostril. For bilateral procedure should upon modifier 50. Okay. Please say yes or no. Okay. Lavage means flushing or washing. For maxillary sinus, go for 31000.
Yes, ma'am.
Sphenoid sinus, see that image. Sphenoid sinus 31002. So here lavage method, procedure is lavage. So for maxillary sinus 31000. For sphenoid, see that sphenoid sinus 31002. Okay, then 31020 for sinotomy. Surgeon directly make a cut on the sinus and remove the infected air or fluid. For maxillary 31020, sphenoid 31050, for frontal 31070. For frontal 31070. So during sphenoid, Kriti? Along with, if surgeon also remove the polyps means go for 51. So sphenoid sinotomy along with removal of polyps means go for 31051. Did you understand? Did you understand the meaning? What is the meaning of lavage?
Flushing or washing.
Washing. Okay. So the above 2 core section for flushing or washing technique. The below 3 core section 4 core section for rhinotomy. Okay. The highlighted terms are the key terms. For bilateral procedure should happen modifier 50. So that means procedure is performed on both the side of the procedure, both the side of the sinus. Now first, before that, I just give a question for you. triple line is correct, but that option is present in both C and D. What is the exact answer? D, D, others.
No, C.
C. Actually, C is a wrong answer. D is the correct answer. Is there any additional time or work is spent by the provider here? Is there any document support for 22 modifier?
No, ma'am.
22? No. So 22 modifier for increased procedural service. Increased procedural service. Okay. So here, surgeon give a increased procedural service. When a surgeon spend extra time or work means you should consider as a 22 modifier. But there is no documentation support for increased procedural service. So that's why 30999 is the correct answer. Okay.
Okay, ma'am.
Did you understand?
Yes, ma'am.
Now try the next question. Answer. What about the modifier 78? What about the modifier 78?
Unplanned entering operating.
Unplanned return to the operating room. This is not unplanned. This is a secondary surgical procedure. Okay. This is a secondary surgical procedure. This is not unplanned. It's a planned. So that's why 30450. Option A is the correct answer. Any doubt? Any doubt?
Ma'am, it is in right.
There is no document as support for plan. It's surgical. Surgical procedure, secondary rhinoplasty. Secondary surgical procedure means that indicate the follow-up surgery. After completion of the primary surgery, doctor will decide for the secondary procedure. So that type of procedures are called a secondary surgical procedure. So it's a planned one. That's why should not upon modifier 78. Did you understand now?
Yes.
Now, we will discuss later about this question. Now, nasal endoscope. So, nasal endoscope means that scopy is used to view the nasal. Okay, that scopy is used to view the nasal. In that nasal endoscope, we have two classification: diagnostic and surgical. What is the meaning of diagnostic? Mean doctor perform the procedure to find out the problem. Doctor perform the procedure to find out the problem. That is nasal endoscope. Sorry, that is diagnostic procedure. Diagnostic procedure means doctor perform the procedure to find out the problem. That is diagnostic. Surgical means that is treatment to cure the condition. So here doctors use nasal endoscope. Yeah, automatically. Sorry guys. Guys, am I audible?
Yes, ma'am.
Okay. So for nasal endoscope, doctors use this endoscope to endoscope. And 31230 for nasal with the maxillary sinoscope. The above code section for nasal endoscope only. Then the following code section for nasal with the sinoscopy. That means for maxillary sinoscope 233, sphenoid sinoscope 235. 31233 for nasal or sinus endoscope with the maxillary sinoscope. 235 with the sphenoid. The above three code section for diagnostic procedure. That means surgeon use the scopy to find out the problem. And from 31237 to 239 for surgical. 31237 to 239 for surgical endoscope. Surgical endoscope. What is the reason for that scopy? Doctor use the scope to remove the polyps or debridement. Debridement means cleaning. For polypectomy or debridement, 31237. Control of nasal hemorrhage by using the previous slide also we are discussing about kind of nasal bleeding. But doctor control the bleeding by using of cartridge. By using of cartridge or packaging, doctors control the bleeding. But 31237 for 238 is also for control of nasal bleeding by using of endoscope. Doctors control the nasal bleeding. Then 31239 for dacryocysto-rhinoscopy, rhinostomy. That means procedure is performed on lacrimal gland, lacrimal duct. Procedure is performed at the lacrimal duct. So these are the procedure. First you have to check whether the procedure is performed for diagnostic or surgical. Endoscope is nothing but like that. Here, this is an endoscope. At the end of the scope, at the one tip of the scopy that contain camera and flashlight, and then the another end connected with the monitor. Okay. At the one end of the scopy that contain camera and flashlight, then the another end that connected with the monitor. Okay, so that is endoscope. Based on the name of the scopy. Here, for example, nasal or endoscope. That means that type of scopy is used to view the nasal and the sinus. Okay, is this a diagnostic scopy, diagnostic or a surgical procedure? Is this a diagnostic or surgical? Diagnostic or check that 312 more. That means anterior portion only, partially remove the ethmoid 54. Total means both anterior and posterior. Both anterior and posterior for total 253 total ethmoid with the removal of tissues from frontal sinus. Okay, both remove anterior and posterior of ethmoid along with surgeon also remove the tissues from frontal sinus. Go for 253. Then 257 for sphenoid. Then this is a intended code. We have to read from the standard code. That means with the ethmoidectomy and sphenoidotomy. Ethmoidectomy and sphenoidotomy means go for 31527. Ethmoidectomy and sphenoidotomy 31527. Did you understand now?
ma'am. Ma'am, in 257, it doesn't include the removal of tissue from the frontal sinus, ma'am.
No. This is how can we read the code of can please read the code description of 31527? Read the code description of 31527 now.
Here they mention that total anterior and posterior. I am saying that this is include only for the ethmoidectomy and for the sphenoidectomy. Is it right, ma'am?
Actually, Mama, I am asking about the code description only. I do no need a explanation. Just read the code description of 31527. 315. Just read.
Total anterior and posterior, including sphenoidectomy.
No, it's wrong. Anyone, can you
Nasal
read the code
sinus.
description of 31527?
Nasal or sinus endoscopy,
Nasal or
surgical with ethmoidectomy, total anterior and posterior, including sphenoidectomy.
So every intended code must we have to read from the standalone code. You can't directly read the intended code, guys. Sorry. Yes, you can't directly read the intended code. Every intended code must read from standalone code. So nasal, sinus, endoscope, surgical with ethmoidectomy, total sphenoidectomy. So here during the same session, doctor remove the ethmoid as well as sphenoidomy. B5 to 57. Okay, did you understand? Did you understand now? Okay. So here guys, every intended code must you start from the standard code. That is important. Then only you can understand the full code description. That's it. The first image for laryngotomy, then the second image for laryngectomy. Laryngotomy means surgeon just to make a cut on the larynx, go for 31300. Surgeon just to make a cut on the larynx, go for 31300. Laryngectomy means removal of larynx. Laryngectomy means removal of larynx. In that laryngectomy, we have a two classification: total laryngectomy, three classification: total, subtotal, and partial. In laryngectomy, we have three classification: total, subtotal, and partial. In total, with radical neck dissection 360. Sorry, without, with the radical means 365. So subtotal means 75% larynx should be removed. 75% of larynx should be removed. So subtotal same like that. Without radical neck dissection 67, with the radical neck dissection 68. And 70 for partial laryngectomy. Horizontal, vertical, anterior vertical, laterovertical, anterior lateral. Here, this term that mentions the cutting position. Vertical, laterovertical, anterior vertical, that means horizontal. So here that horizontal, laterovertical, anterior vertical, anterior laterovertical, these terms that mention the cutting position. Cutting position. So in laryngectomy means removal of larynx. In that we have three classification: total, subtotal, and partial. Subtotal and subtotal that are classified as without radical neck dissection and with radical neck dissection. Partial laryngectomy is classified as based on the cutting position, horizontal, vertical, like that. So is there any doubt in this laryngectomy? Any doubt?
No.
Okay. Now take the meaning of radical neck dissection. Please everybody take a note. from collarbone to neck. Collarbone to neck. That is called as with radical neck dissection.
Okay.
So okay. So if that term present means go for with radical neck dissection. Did you understand? Any doubt? Then pharyngolaryngectomy. Removal of pharynx as well as larynx means go for 31930. Guys, did you understand the definition, meaning of that code description? Did you understand?
Yes, ma'am.
Okay. So code description, that means meaning is a very, very important one. You must understand the code description. Then only you can able to understand the question. Okay. For understanding of code description, if you want to understand the code description very well means, you must read about the terminology. So terminology is very, very important. Anatomy and terminology is very, very important. Then endotracheal for epiglottomy 31420. 31420 for epiglottomy. For endotracheal intubation 31500. 1 minute. Endotracheal intubation. That is called as endotracheal intubation for temporary respiration. Doctor inserted tube from mouth to trachea for temporary respiration. That is called as endotracheal intubation. Now, for inserting of endotracheal intubation for emergency purpose, go for 31500. Okay, first you have to understand the procedure. Okay. Then laryngoscopy. So the name of the scopy is laryngoscopy. That means that scoping is used to view the larynx. Okay. Nasal endoscopy. Scopy is used to view the nasal. Laryngoscopy means scopy is used to view the larynx, like that. In that laryngoscopy, we have two classification: indirect and direct. In laryngoscopy, we have two classification: indirect and direct. Indirect means by using of monitoring system, doctor view the inside of our larynx. By using of monitoring system, doctor can able to view the larynx. The direct means without monitoring system. Without monitoring system, doctors view the larynx through their own eyes. Without monitoring system, doctors just view the larynx by their own eyes. That is direct. In that indirect, so first you have to check the type of scopy. So the scopy is laryngoscopy. So in that laryngoscopy, we have two classification: indirect and direct. Then what is the procedure? 31505 laryngoscopy for
Indirect.
direct. Yes. What is the usage? Diagnostic.
For the diagnostic.
For diagnostic, that means doctors use that scopy to find out the patient problem. To find out the patient problem. For diagnostic 505. means 511. Lesion removal means 512. Suppose for vocal guard injection means 513. Apart from that reason, apart from these reasons, if any other reason is used for diagnostic means go for 505. Apart from these four reasons, for any other reason, doctors use laryngoscopy for diagnostic purpose means go for 505. Did you understand?
Yes, ma'am.
Did you understand? Then same like this is a scopy of laryngoscopy direct. Sorry, direct. What is the reason? Aspiration. Aspiration means suction. To suck the fluid. To suck the fluid. For aspiration, 515. For a direct laryngoscopy diagnostic, newborn, 520. What is the period of newborn?
0 to 28 days.
0 to 20 days. So for a birth through following 28 days baby only, we can apply the code 520. From 29th day or older. From 29th day or older, go for 31525. From 29th day or older, go for 31525. Excepting newborn. For even for adult child, we can apply the code of 525. And 31526, laryngoscopy, direct with or without tracheoscopy, diagnostic with the operating microscope or telescope. So this is also the one of the diagnostic procedure. Along with laryngoscopy, if doctors also use microscope or telescope means go for 526. Along with the laryngoscopy, if doctors also use microscope or telescope means go for 31526. So, but do not report 31526 along with 69990. So, when you are reporting 31526, should not report the code 69990 with 31526. Okay, sure. That means 69990 is a specific code for operating microscope or telescope usage. 6990. 69990 is the code, is a specific code for operating microscope or telescope. In this code description, as a default, this code is for microscope or telescope. That's why no need to report the 6 series along with the 31526. Did you understand? Did you understand?
Yes, ma'am. Yes, ma'am.
Then obturator. Obturator is one of the man-made device. This is a surgical procedure. The above three core section for diagnostic. 515 is the therapeutic. 27, 28, 29 is also the therapeutic. You have to check the reason. Reason is inserting of obturator. Inserting of obturator. Okay, so that means inserting of obturator is the man-made device. Inserting of obturator 527. If surgeon use laryngoscopy to dilate the larynx, dilation means enlargement. For enlargement of larynx for initial 528, subsequent 529. Initial means for initial first time dilation. Initial means